Now, when working on a cranium that is fixed in extension, the most important correction that you will need to do in order to restore proper functioning of the cranial mechanism, but also to reduce that augmented traction that is being placed on the brainstem and everything in this important suboccipital area. And so therefore, your most important goal and technique is going to be to try to augment and bring the cranium back into flexion. Now, it sounds simple, and sometimes some of the simplest techniques are all that you need, but you're going to need to focus on that same technique over and over throughout many cycles until you finally feel a release, and then you're able to actually really start doing some correcting. So you'll see, as I've inserted the image on the screen, you're going to be holding our sphenoid and our frontal area in a more global hold. And we're going to have our hand cupped under the occiput with our goal of augmenting flexion. So once again, when we work on a client like this, we're going to find that their head and the occiput is very shunted upward, right? So it's going to be a head that's actually a little bit more like this when it's stuck in extension, a little bit more like that when it's stuck in flexion. So when we have a client that is stuck in extension, as the occiput goes into that very short and probably brief phase of flexion, we're going to augment that flexion. So we're actually going to push inward, trying to augment that phase of flexion in space and also in time or duration. So just like I taught you when you were working on trying to undo a pattern that is stuck in flexion, when you're trying to undo a pattern that is stuck in extension, you want to induce pressure and compression with your hand towards the occipital base, augmenting flexion, but also in time. So as I had described earlier, I'm going to use my hands to give you a demonstration. If we have a cranium that is stuck in extension, it's going to want to go towards extension a lot and stay there, and then maybe go very little into flexion, and then go into extension again, and then very little flexion and go into extension again. That's what you're going to feel in your hands. And so therefore, when you're working on trying to increase flexion, you're going to allow the cranium to go into extension, but try to halt it somewhat. And then you're going to increase that flexion, not just